So, I want to discuss now on histamine receptor antagonist. Histamine receptor antagonist. And when you say an antagonist, what's an antagonist? Remember, we have different type of antagonists. We have physiological antagonists. We have pharmacological antagonists. What's the difference? Physiological antagonist is an antagonist that actually produces the opposite effects that a hormone is produced, that a hormone is supposed to produce. Let me just put it this way. If you have a hormone that's supposed to cause constriction of blood vessel, and another hormone causes dilation of blood vessel, but that hormone does not actually bind to the receptor of the one that causes constriction. The one that causes constriction has its own blood receptor. It will just bind to it, cause constriction. But it's another type of hormone that it will just go to another receptor, binds to another receptor, and cause the opposite effect of that other one that causes constriction. It will now cause dilation. That's what we call physiological antagonism. A type of antagonism where you don't bind to the receptor of another hormone. You bind to your own receptor, doing your own thing, but producing the opposite effects that hormone is producing. However, pharmacological antagonism is when you actually block that receptor. For example, a drug supposed to cause constriction, you now block that receptor so that drug that's supposed to cause constriction cannot bind to its receptor, so it cannot be active. So what happens? The opposite effect, dilation occur. So that is pharmacological antagonism. Yet they bind to that receptor of the hormone that's supposed to perform an action. So for the physiological antagonist of histamine, what can produce the opposite effects of histamine? It does not bind to the same receptor as histamine. It's what we refer to as epinephrine. Yes. So epinephrine can produce the opposite. It's an example of physiological antagonist. Then example of a pharmacological antagonist is where we have antihistamine. They block the receptor of histamine. They are pharmacological antagonism. All right. So for antagonism, remember we mentioned three receptors for histamine: H1, H2, and H3. We were talking about H1 receptor antagonists. Do you get? We've already listed the agonists. So we're talking about the H1 receptor antagonists. Then we can classify them more. H2 receptor antagonists will not majorly be discussed here. Do you get? They'll not majorly be discussed here. Remember, we said H2 receptor antagonists from that above are used in the treatment of what? Are used in the treatment of what we refer to as peptic ulcer. So in peptic ulcer material, I'll talk about that mainly. All right, so let's go. H1 receptor antagonists can actually be grouped into two generations, the first generation and the second generation. The first generation are sedating, while the second generation are non-sedating. The first generation can also be grouped into the ones that are highly sedating, the ones that are moderately sedative, and the ones that are mildly sedative. When we talk about highly sedative H1 antagonists, this selective H1, they bind to only H1, they block H1. They are highly sedative. That's where we must remember things like diphenhydramine, dimenhydrates, promethazine, very common. The ones that are moderately sedative, first thing that should come to your mind, cyproheptadine, because cyproheptadine is also an anti-serotonin. It blocks both serotonin and they also block H1 receptor. Buclizine is also another example. The one that are mildly sedative, that's where you have things like chlorpheniramine. It's an example of mildly sedative. Then for second generation, they are non-sedative. That's where you have drugs like loratadine. Fezofenadine is no longer used, it's banned. Fezofenadine, but loratadine is very common. Desloratadine, these ones are second generation drugs, second generation antihistamine. They inhibit H1 receptor. All right, so let's now look at this. This is just a recap of what we've been saying. All right, the triple response of histamine, we've already seen that. Let's just try to make the tutorials quick now. Anti-allergic reaction, we've seen that they can be used to treat allergy because histamine actually causes itching. You get urticaria, anaphylactic reactions. So antihistamine can be used to treat these things, to treat type 1 hypersensitivity reaction. All right, it can suppress them, it can control itching, it can control urticaria, it can control anaphylactic reaction, but it's not used in the treatment of bronchial asthma. It is not used in the treatment of bronchial asthma. All right, then in the CNS, you see it does not cross CNS, but some amount can actually enter into the CNS. Take note of this, it's action in the CNS. Remember, vomiting center is fine in the CNS. You get so sometimes there are some persons that when they are pregnant, they actually vomit a lot, which we call hyperemesis gravidarum, vomiting excessively while pregnant. Right, you can use promethazine. Promethazine is the first line of drug you can use when treating that condition. Histamine can cause vomiting, so antihistamine can be used in the treatment of vomiting. Do you get excessive vomiting in a pregnant woman? Promethazine is among the first line drug used for treating hyperemesis gravidarum. The woman who is vomiting excessively, exaggerated pregnancy symptoms. Okay, then you can also use to treat motion sickness. Promethazine can also be used to treat motion sickness. Do you get? All right, then let's move on to the next. Here, it talked a little about the pharmacokinetics of antihistamine. Under the pharmacokinetics, they are lipid soluble, so they are well absorbed orally. And for them to be excreted, they actually have to undergo metabolism in the liver. So they undergo metabolism in the liver, and they are excreted in urine primarily. For these drugs we've mentioned, their half-life, their duration of action is 4 to 6 hours, but the only ones that their duration of action is longer than 4 to 6 hours is CLF, cetirizine, loratadine, and fezofenadine, the one that is now banned. All right, so that's that. The first two, C and L, are excreted in the urine, whereas fezofenadine is actually excreted in feces. Okay, so that's for that. These ones are things we've mentioned before. Therapeutic uses, we can see them already. Can be used to treat allergic reaction. They are just repeating the same thing. Sorry about that. They are used in treatment of allergic reactions. Promethazine is used in the treatment of motion sickness. Parkinson's disease, promethazine can be used. Hypnosis, sedative hypnostic, you can use promethazine. For acute muscular dystonia, promethazine. These are just their uses. Second generation is better than first generation for some reasons. Why? Second generation, there's absence of CNS depression. Second generation has no anticholinergic side effects. Second generation is non-sedating, and you can use it when driving. It does not induce you to sleep. It does not potentiate benzodiazepine effect, so it's better. Fezofenadine, second generation, that's been banned. Loratadine is second generation. We already said that desloratadine is the second generation. Cetirizine, we also talked about. So these are just the only aspects remaining. H2 receptor antagonist, remember cimetidine, loratadine, they block H2 receptor. They are used in the treatment of peptic ulcer, as already explained. And that's that. We'll be discussing peptic ulcer material. So that's actually that about this material. Histamine, its physiological role, you should remember, it plays a role in allergy, it plays a role in vomiting, it plays a role in itching. It has different physiological role to play. It plays a role in the secretion of HCl. So that's that. The receptor location, we've already seen the locations and their actions. The H1 receptors, the CH1 receptors in various locations, the smooth muscles, blood vessels, CH2 in the gastric gland, H3 in the brain, all of that. Important of first generation, of second generation over first generation, you already know. Know the example of first generation, the highly sedative, the moderately sedative, and the mildly sedative. Then second generation, they are non-sedating. You know the example of second generation, those loratadine, desloratadine, they are second generation. So that's that. and you know this individual drug. Promethazine, we say it is used in motion sickness. You can use it. You can also use it for the treatment of hyperemesis gravidarum, Parkinson's. There are different conditions where you can use promethazine. All right, so that's that for that on this material. Thank you very much.